Could you talk about any stories you had in that building?
For once, I had no idea this whole place was a diner.
When you guys look at that, what could that be right there?
It'd be like a place for like sell clothes or something.
No, where it could be a jump house.
Jumping house?
Yep.
During the summer of 2012, I lived in McDowell County, West Virginia, while making a documentary called Hollow. Hollow was made in collaboration with the community. We trained kids and adults to film their own lives.
The old buildings, these buildings could be improved and these things could be made into like different resources or different kinds of business.
Residents interviewed one another, some documented problems, others just showed us things they loved. During that summer, I met Marla Brown. She was just 10 at the time, and she was in a grant-funded program called Sky's the Limit. It was aimed at giving kids in the coalfields some opportunities for health and learning over the summer, and camera training became one of those activities. I wanted to catch up with her 8 years later. She just graduated from high school, and she's attending Marshall University this fall.
What do you think has made you successful?
Probably my parents, because they kind of get on me if I slack off, or like if I get a bad grade, they'd always do what they could to help me. I've seen like kids in my high school who have gone down like different paths and who've kind of like either dropped out or like, just stopped caring, could tell they probably didn't have the same parental support or, sometimes a good home life to go back to.
The high school dropout rate in McDowell County, West Virginia is 34%. Studies show that kids who don't finish school are more likely to get involved with risky behavior, like drug use, at a young age. But while these statistics sound extreme, one researcher says the chances for youth drug use and risky behavior is similar all around the world. Dr. Alfgeir Kristjansson is an associate professor at West Virginia University's School of Public Health. He's lived in West Virginia for the past 8 years. He studies drug prevention models all around the world. And he says individuals have less impact on their environments than we tend to believe.
For me, it's largely a systematic problem. I don't think people in West Virginia are any different from people elsewhere. All the places we've collected data, including, Eastern Europe, Western Europe, the counties in West Virginia and Chile, for example, we aren't really seeing any difference in terms of what those natural risk and protective factors mean. If you just look at the statistics, if you grow up in poverty and you grow up in social isolation, the odds are overwhelmingly that that's going to continue in your life.
Breaking generational poverty is something many kids all across West Virginia are up against. And in all my years living and working in West Virginia, I've never really seen a program that gets to the root of our issues and continues to help beyond its grant cycle.
We need a massive investment of infrastructure in order to make these things happen. We need to stop dipping into short-term solutions that are only going to work for a limited time. I could talk forever about my frustration with the grant system here. I think it's insane. And I understand that you would have a competitive grant system for research purposes, but to fund human services with inadequate short-term funding is an insane idea. If you think about the kids that come into those programs, those kids have been let down time and time and time again. They make friendships with people that run the programs, and then the funding runs out and the people leave.
When I worked with kids like Fred and Marla, coal trucks barreled by us. The sidewalks were crumbling. It felt unsafe to walk the main road, let alone be a kid and ride a bike. The environment was one in which the adults had failed to maintain. Alfgeir says our social systems, including environments, must be addressed if we are to improve outcomes for youth. Take Iceland, for example, Alfgeir's home country. In Iceland, drug, alcohol, and tobacco use in teens has been virtually eradicated as a result of a nationwide push to replace teens' unsupervised, aimless leisure time with purposeful, organized activities. The country recognized underlying issues like lack of opportunity and inadequate parenting that reveal substance use among youth is not randomly distributed. Now Alfgeir is working with West Virginia schools to implement the Icelandic drug prevention model. He has funding for the next 5 years from the CDC.
Iceland seems to have found a way to take a culturally produced problem and give it the time and attention and the scope it deserves to actually make a long-lasting change. Let's not work with the kids at all. Let's just work on changing their environments so that these things are in place. The third thing that Iceland has done almost everywhere is massively invest in organized leisure time opportunities, which is massively needed in West Virginia. Kids that grow up in areas where there is more or less nothing like that available to them, they have to find and carve out their route themselves. The most reliable infrastructure to extend leisure time opportunities are the schools. We will use what and should be using and utilizing our assets. The nature and beauty of West Virginia is a big asset, and there's plenty of ways to utilize that space better, from further trailing to fishing to mountain biking. You ask them, what do you really would like to do more of? They're not asking for any fireworks or regular trips to Disneyland. They're just asking for, I would love if I could do this regularly. And usually it's something in their immediate environment. You know, archery, kayaking, keeping the swimming pool open a little bit longer. These are things that can relatively easily be acquired.
I remember they had Girl Scouts when I was younger, but we didn't really do much. Even starting scout clubs and stuff like that again, and having like them go on hikes and do more nature-centered stuff would be a good idea. I love going on hikes, or like, I can't remember the name of the state park, but I went there a couple weeks ago and they had like a waterfall, and I love doing stuff like that. I do feel better. Like, I feel calmer, and I feel like when I'm out there, I'm like, oh, like this hike's gonna take like an hour, but like when I'm out there walking, I don't even really count the time. It just passes by, you know.
What I really would hope to show is that what we are doing works and will show impact. And if it does, then I want to go to the state government and say, let's stop. Just stop all the short-term programs. Just change your mindset. Think about systems and infrastructure.